Good day, I'm Lorraine Mendez and this is your JIS News for Tuesday, April 16. The Ministry of Health has initiated mandatory training of its rapid response teams across the island in reaction to a worldwide increase in measles cases. About 60 healthcare professionals have already been trained in measles outbreak response. The Health Ministry says information on administering the measles vaccine to children aged 12 and 18 months have been communicated to all parish health teams. Members of the public, especially parents, are urged to visit the nearest health center to ensure their children are fully vaccinated, as measles kills more children than any other vaccine-preventable disease. The Health Ministry says in addition to sensitizing doctors and health professionals, it has started a public education campaign to inform and safeguard the public against measles. Measles typically begins with a high fever, cough, runny nose, and red, watery eyes. A few days later, tiny white spots may appear inside the mouth, and following that, a rash of flat red spots appear on the face, neck, arms, legs, and feet. Still on health, children needing cardiac services now have access to a $5 million state-of-the-art facility at the Bustamante Hospital for children. The 10-bed Paediatric Cardiac Cente was opened yesterday. It includes an intensive care unit, operating theatre and biplane catheterization laboratory, and offers surgical and aftercare cardiac services. The facility was built through a partnership involving the National Health Fund, Chain of Hope Jamaica, Gift of Life, Digicel, Sagicor, Rotary Club, and the Shaggy Make a Difference Foundation.
Partnerships work, and we must embrace it, we must support it, we must accommodate it without fear or favor, as long as those objectives are aligned. And I believe that is the case today.
In addition to carrying out cardiac procedures, the center is expected to provide specialized training for surgeons, nurses, and other pediatric cardiac personnel, as well as doing research. Meanwhile, Health Minister Dr. Christopher Tufton has unveiled plans to build a 20-bed facility to support the pre- and post-care of the Paediatric Cardiac Cente's catheterization laboratory and operating suite. It's expected to cost up to $100 million to build and equip the facility. Dr. Tufton says the National Health Fund team, working with the Southeast Regional Health Authority, has been having discussions with some of the partners to do a technical assessment.
I am committing that we will deliver this building within a year after approvals are given, which normally takes 3 to 4 months.
According to Minister Tufton, over 400 children are born in Jamaica with congenital heart-related disease, about 200 of whom require some level of surgical intervention. In other news, government has signed 2 financing agreements with the European Union, EU, valued at 20 million euros or 2.8 billion Jamaican dollars. The agreements, which were signed on Monday, fall under the 11th European Development Fund. 509 million Jamaican dollars is to support the Public Finance Management Reform Program, with an initial disbursement of $132.5 million.
Under the Public Finance Management Program, we are assisting the government in building the necessary structures of a modern, integrated financial management system, which will further improve public governance, transparency, accountability, and delivery of public services.
Forest management will also be addressed through a disbursement of 2.3 billion Jamaican dollars, starting with 279 million.
The Improved Forestry Management for Jamaica Budget Support Program in the amount of 16.5 million euros is intended to build the country's climate resilience by promoting sustainable forest management. Importantly, the program will also be seeking to better utilize forest resources for economic and social purposes.
The EU represents the largest provider of grant resources to Jamaica through its cooperation program in support of Jamaica's National Development Plan, Vision 2030. Meanwhile, CARICOM and the European Union have signed 6 financing agreements valued at 114.8 million euros. The money will support the framework for CARICOM integration and the implementation of CARIFORUM States Economic Partnership Agreement. Also on the agenda are the Caribbean Investment Facility and criminal justice systems, as well as promoting regional integration in the Organization of Eastern Caribbean States. The agreements were signed on Monday by Secretary General of CARICOM and the CARIFORUM, Ambassador Erwin Larocque, and Commissioner in charge of International Cooperation and Development in the European Commission, Neven Mimika.
It is also testimony to the commitment of both the European Union and CARICOM and CARIFORUM to the importance of regional cooperation and integration as a means to address the enormous challenges faced by this region.
I look forward, like you, to timely commencement of implementation so that the benefits to be derived can be felt in the short to medium term.
And finally, over 40,000 students today sat the language arts and science components of the curriculum-based test in the primary exit profile PEP exams. They will complete PEP tomorrow when they sit the mathematics and social studies components of the test. The 90-minute exams are comprised of 40 selected and constructed questions. PEP's ability test was conducted on February 26, followed by performance task on March 27 and 28. Parents and teachers of grades 4 and 5 students are being urged to work with their children as they prepare to sit the performance task exams in the coming months. Grade 4 students will sit the exam on May 30 and 31, while the test will be administered on June 20 and 21 for grade 5 students. And that's it for JIS News today. I'm Lorraine Mendez. Thanks for watching.